Hi, I am Dr. C. Suman Kumar, consultant pediatrician at Ankara Hospital. Thanks to COVID, a lot of new problems have surfaced. What are these problems? We have seen kids becoming highly impatient, highly hyperactive, losing focus, highly irritable. This is a common problem which parents are coming up, and even the learning things. Children who used to speak well suddenly are having sluttering of speech. Children used to speak with sense suddenly started speaking, without any sense. The children's speech ability itself has gone down. Children who are supposed to speak at least minimum 1 to 2 sentences fluently or 5 to 10 words fluently by 2 years of age are not even in a position to speak at least one word, and children are not maintaining an eye contact. This is a common scenario we are seeing of late in most of these children. We call this as a hyperactivity disorder, we can call it as autism, we can call it as learning disability, we can call it as difficulty, but this is something which we have to recognize quite early, catch it quite early, and we need to work with the child. Otherwise what happens, this child might end up having lifelong learning disabilities. Why are we seeing this problem of late very common? There are a few reasons behind it. Because of the increase in nuclear families, there is no adequate environment for the child. See, every child will be born with certain genes and IQ. If that genes are not provided with proper environment, sometimes this child might develop learning difficulties. Proper environment in the sense, in the proper stimulation. There should be somebody who should be talking to the child, playing with the child, interacting with the child, because this is the age, especially between one year, especially right from the time of birth till the child reaches 4 to 5 years of age. This is a time when brain develops to the maximum. By 3 to 4 years, 80% of the adult brain is formed, and that is when the new neurons will be forming, and there will be synaptic connections in between the neurons which keeps forming during this time. So every interaction we do, even if a parent interacts with a child for at least 15 minutes, at least 700 new neuron connections form during that time. That's how much of an effect our communication with the child does. And imagine that much connection is lost in the form of keeping the child in front of a television or a tab or a mobile phone without anything, because we have got other works to do, and we feel that the child is quiet by keeping this. What happens, the child stops to think. These neurons which are supposed to develop during that phase, they stop to develop because there's nothing to think. And these connections which are supposed to form, I said 15 minutes of interaction will result in 700 new connections, especially during this phase, and this is lost. And imagine if the child for hours together is in front of the mobile, tab, these entire connections which are helpful for the lifelong evolution of the child, these will not develop for lifelong. A child who would normally be a normal child, normally intelligent child, would become low IQ child. He will be having learning difficulty, he will be having speaking difficulty. And it is more common nowadays because of nuclear families, lack of joint families, lack of stimulation. Both the mother and father are working, they have got little time. Either the child is left with the maid or left with grandparents. And if the grandparents' IQ is less, what do some of the grandparents do? They just feed the child, make the child in front of the CV, give bath to the child, make the child get ready, feed the child, keep the child in front of TV, and the cycle repeats. There is hardly any interaction, they hardly talk with the child, especially. And if the grandmother has got very good IQ, then the child is very lucky. Grandfather, grandmother, both the grandparents have got good IQ, then they'll start playing with the child, interacting with the child. This child will be normal, no doubt about it. So the more the time we spend with the child on interaction, stimulating, and try to focus on where the child is looking. Wherever the child is looking, we need to describe those things and keep on telling stories. This child will be reciprocal. See, whenever we are with especially smaller children, 6 months, 8 months, even though they don't know the language, when we are talking with them and smiling with them, they smile back to us. When we are frowning, they frown back with us. They tend to react, and whenever they are looking at somewhere else, when we describe that thing, they try to take interest in those things. So in this way, we can stimulate the child in lot of other ways. And the more we talk with the child in the same language what we talk, the more the language and interactive ability and social ability the child will develop. So this is something which we should not miss by providing them with mobile phones and televisions. And second mistake the parents think is, just by showing them rhymes, just by showing them ABCD, just by showing them some numbers or something like that in a mobile phone, they think that my child will become really smarter, is going to learn all this and is going to learn it for life. No, my dear parents, it is not. That is not a proper way of learning. The proper way of learning is what we tell them, what is not present in the textbooks. Let them learn things naturally. Let them learn numbers naturally by looking at them, rather than we teaching them 1 2 3. This is something which we need to assess, and we need to talk more, spend our time with them rather than the mobile time with them. The moment the parents walk into the house, see that the mobiles are kept somewhere else, and you start spending time with children. The more time you spend with the children, the lesser the chances the child will become irritable, lesser the chances the child will become autistic, lesser the chances the child will have learning difficulties. Even if we have to sacrifice our career a little bit, it is nothing more than the child. We need to sacrifice a little bit, especially our time. Moment we step into the house, it is our time with the child. Remember, we need to spend at least a minimum of 2 to 4 hours in interaction every day with the child, and the screen time, especially in front of mobiles, as minimum as possible. It should not cross 30 minutes at any cost. Moment it crosses 30 minutes indicates you are stopping the brain development of a child. The possibility of this child having learning difficulties in a longer run is very, very high. And second reason why the child becomes really irritable, even though his intelligence is normal, his speech is normal, the child is still irritable. Why is the child irritable? Because they are getting used to frequent change in screen and high music and high loud, because there is constant action which goes on in the mobile phones or television, constant change in screen. To keep us glued, they keep changing every minutes or every 2 minutes. What happens? You switch off the mobile or television, the entire world becomes very dull. There is no action, there is no music, there is no change in color. What happens to this child? The child immediately feels that what boring life I am. The parents who are trying to talk to him will look very boring. So child becomes very irritable and fussy. So this is something which we should not encourage. So it is our time rather than screen time with the child, which would help the child for a lifelong learning. And here, if we allow him to sit more with mobiles and television, take it from me, the possibility of this child having lifelong problems is very, very high. We are already losing a significant amount of generation thanks to COVID. A lot of children have got addicted to mobiles, tabs, and this stuff. It is better we get them and detox them from these things and spend our time with them. Take them out, spend more time with them. Thank you.